হাইপারট্রফিক স্কার অ্যান্ড কিলয়েড। তো হাইপারট্রফিক স্কার অ্যান্ড কিলয়েড জিনিসটা কি? আমাদের চামড়ায় বা স্কিনে কোথাও যখন কেটে যায় বা কোনো মুখে ধরুন ব্রণ হলো বা আঘাত লাগলো, সেখানে যখন সেই ঘাটা শুকোয় বা হিলিং হয়, তখন সেই জায়গাটা স্কার ফর্মেশন হয়ে সেই যে গ্যাপটা বা আঘাত মানে যে ক্ষতটা হয়েছিল সেটা ভরাট হয়। The tissue that injury the wound heal with scar tissue formation. তো যখন এই স্কার টিস্যু এক্সেসিভ পরিমাণে তৈরি হয়, প্রয়োজনের থেকে বেশি, তখন সেখানে হাইপারট্রফিক স্কার বা কিলয়েড হয়। তো কিলয়েড আর হাইপারট্রফিক স্কার দুটোই এক্সাম্পল অফ এক্সেসিভ স্কার টিস্যু ফর্মেশন, কিন্তু দুটোর মধ্যে কিছু বেসিক ডিফারেন্স বা পার্থক্য আছে। The most important difference, hypertrophic scar always remain within the original wound margin. যেখানে আঘাত লেগেছিল তার বাইরে হাইপারট্রফিক স্কার ছড়িয়ে বা স্প্রেড করে না, ছড়িয়ে যায় না। বাট ইন কেস অফ কিলয়েড, it spread beyond the original wound margin with claw-like projection. নর্মাল সারাউন্ডিং টিস্যুতেও কিলয়েড প্রলিফারেট করে প্রোগ্রেস করে with its claw-like projection. It's grow beyond the original wound margin in case of keloid. So, why it happen? কেন হয় এটা? Hypertrophic scar mainly contain excessive proliferation of mature fibroblast, but it does not contain any blood vessel. But in keloid, it basically is contain immature fibroblast and immature blood vessels, and it basically disorderly proliferation of degraded collagen fibrils. It contain immature fibroblast and immature blood vessel, so it grows beyond the original wound margin with claw-like projection. Others important features between hypertrophic scar and keloid. Keloid may be lobulated, discolored, purple, bluish color. Hypertrophic scar raised over the margin, shiny, and keloid may be tender, itchy, or other features like discoloration may show with like bluish coloration or black pigmentation may show. Others, hypertrophic scar is non-tender that much, that does not show that much symptoms like tenderness, itching, but keloid may be tender, itchy, or discoloration may shows in case of keloid. Hypertrophic scar mainly occur within 3 months from the wound, but keloid occurs after 3 months to 1 year after the wound. Hypertrophic scar may show sign of regression after 6 months. It does not show any growth beyond after 6 months. It regress after 6 months. But keloid does not show any sign of regression. It progress as it contain immature blood vessels. So, and keloid may be autosomal dominant, may have some familial or genetic influence. But hypertrophic scar, there is no genetic influence in case of hypertrophic scar. Hypertrophic scar mainly affect the children. Keloid affect 10 to 30 to 40 years of age group. Maybe female are more affected than male. Black people like African dark pigmented, dark skin people are mostly affected. If a person have some tuberculosis, the chance of keloid formation is more in case of a person infected with tuberculosis. These are some important features. Other features may be one of the most important thing to tell about hypertrophic scar and keloid. Both are benign condition, does not show any tendency for malignancy. Keloid and hypertrophic scar both does not show any tendency for malignancy. And So, keloid, the common site, front center of the chest, over the sternum, shoulder, back, facial site. That's acne scar. That's acne keloid. Ear lobules. Um as it there is a claw-like projection and may be lobulated in case of keloid, but these are some important features of hypertrophic scar and keloid. So now, what is a treatment option for keloid? Intralesional injection of steroid, triamcinolone, may show may regress the flatten the keloid tissue. Others treatment option like silicone sheet application, pressure dressing, uh, vitamin A injection, and others option like surgery and radiotherapy alone may show high recurrence rate. So surgery done for debulking the large keloid tissue and combined with intralesional steroid injection may show some good result. Also, radiotherapy alone there's a high chance of recurrence. When the surgery is done, the thin rim of keloid tissue left and wound closed, primarily closed. Um, Others, if there is a if surgery wound for keloid covered with skin grafting, the donor site, there may be a chance of another keloid formation. So it not done. It is closed primarily with combined international injection of steroid for better result. Others treatment option, as told before, silicone seed application, pressure dressing. For hypertrophic scar, wait for 6 months. It may show sign of regression after 6 months, and if surgery can be done and wound may be primarily closed. Hypertrophic scar, there is a no recurrence if the predisposing factor removed after surgery. But keloid have some high recurrence rate. So these are some basic idea of hypertrophic scar and keloid. So if you have a problem of excessive scar tissue formation after wound over the skin or front of the chest, please discuss with doctors. Um, Choose the best treatment option available. Thank you. ভালো থাকবেন. See you again.